Hello and welcome to the Feeling Good podcast. I am your host, Fabrice Nye, and joining me here in the Murrieta studios is Dr. David Burns. Hi, David.
Hi, Fabrice.
Dr. David Burns has been a pioneer in the development of cognitive therapy, and he is the creator of the new team therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 20 languages. He is an emeritus adjunct clinical professor of psychiatry at the Stanford University School of Medicine. We're going to do a mini podcast this time, and just before we started, David was mentioning something that made me puzzled. And David asked me, so what do you do when you're with somebody with whom you're bored? And I thought, well, that's a good question. And actually, it doesn't have to be a patient; it can be anyone.
Yeah, it often comes up in dating situations, and it often comes up in clinical situations as well. And by the way, we're just taking a break from our anxiety series. We have many more cool podcasts on various ways of treating anxiety, but we're just going to give a little change of pace today and do one of our Ask David series. So first we'll talk about how do you deal with someone who's boring, and then how would a therapist deal with a patient you don't like?
Yeah, that too. Yes. Maybe because they're boring.
Right. And part of the underlying philosophy here is that a lot of relationship problems come up because we, on one level or another, blame the other person.
Yes.
Rather than looking at our own role in the problem and what we can do to change the dynamic. When I was a psychiatric resident, the first 2 years I was at Highland Hospital up in Oakland, and one of our supervisors was Miles Weber. He was a psychiatrist, and I really liked him, and he always seemed to have a lot of wisdom. I was in a seminar with Dr. Weber and probably 3 or 4 other residents, and we were talking about different cases, patients we were treating, and coming up with, tips or techniques that might be helpful for that individual. And then one of the residents asked the question, what are you supposed to do when you get stuck with a boring patient?
Yeah.
And Miles Weber said, well, what you need to know is that there are no boring patients at this time in California. There's only boring psychiatric residents. And then he went on to explain what he meant by that, and he said, when you're bored with someone, it's not because that other person is a boring person. There's no such thing as a boring person, but what's happening is that there's no dynamic in the interaction.
Exactly.
And you're not talking about your feelings. You're not being real with the other person. And he said there's 100% cure for it, that you can instantly make all human interactions or therapeutic interactions.
That's what got me interested. So you can instantly change that.
To dramatically interesting and exciting. And he says all you have to do is tell the other person that you're feeling bored. And it suddenly won't be boring at all. Now, what you have to do, though, because these are subtle techniques, you have to do them in a kindly way, rather than as a put down, and by kind of blaming yourself rather than blaming the other person.
Yes, the difference between expressing and acting out.
Yeah, but you can do it in a nice way.
Yeah.
And I've always found it effective, by the way. But you can say something like, June or Bob or whoever the person is. A few weeks ago, when you talked about your son's suicide and the tremendous grief that you were having and the shame that you've been feeling, and you wept, and I felt so close to you, and we were so connected. And that, I don't know if you've noticed that in the last couple of weeks, for whatever reason, we've kind of drifted into a kind of a chit-chat and mentioning a little about the politics in the election or the stock market or things like that. I find my mind drifting away, and I don't feel as connected with you as I was. And I wondered if you're noticing the same thing and what your feelings are about it. Tell me how you've been experiencing this.
Yeah, so you're just stating that as this is what's happening. It's not about you, not about me. It's just that's what's happening, and so let's look at this. Together.
Yeah, and you can even go too far as to say, to tell you the truth, some of the time I've been feeling kind of bored, and then I've been kicking myself and saying, David, why are you so bored with Bob or Sarah, whoever the person is, who's such a dynamic and human and compelling person? And maybe you've been feeling that way too. Tell me how you're experiencing it, and then instantly the situation will become quite dynamic.
And this really points to one of the 5 secrets that is very important, and that's classically forgotten, which is I feel.
Yeah, absolutely. The first time I ever became aware of this was when I was a medical student at Stanford. This idea that there's no such thing as a boring person, and I learned it in quite a different and pretty frightening and powerful way. I used to go to these psychodrama marathons. I didn't go to most of my classes. I was a terrible medical student. I never should have gone to medical school. It's a wrong thing for me. But I coped
but
with
it happened.
my anxiety.
At the time, that was the path to becoming
I'm glad I'm where I'm at now, but I would take a different path than the second time around. But I become a clinical psychologist like yourself, I think. But at any rate, I used to go to these psychodrama marathons, and they were led by this fellow who died a couple of years ago, Hussein Chang, and he described himself as this crazy Chinaman. And he was this short little fellow who had bilaterally deformed hips, so he didn't walk very well, had to have a cane. But he would get people into a house for 48 hours or 72 hours. We'd pay like $35 for the weekend, and you went up night and day, generally for 48 hours. And there would be 35 people present, and they'd be seated in a circle. In fact, the first one I went to was just half a mile from where we're sitting right now, in the Hidden Villa Ranch.
Oh, okay.
They rented one of the houses there, and it took place in that house. And what happened in these marathons was kind of brutal, and it's not something I'm recommending.
No, but I know about those, although I never participated in them, but I really I've heard a lot about it.
Yeah. They were mind-blowing, and they had these really powerful assistants, and they weren't psychologists. I think a lot of them were just gotten out of prison or whatever, kind of street thugs, but they were very savvy about human nature, and they would take people out into the middle one at a time, and they would really confront you on your weakness.
Hot seat,
until you finally lowered your defenses and wept and opened up and showed who you really are. And I had a powerful experience like that at that marathon. But what I saw was that there would be, and then I did an internship there. So I think it was 6 weeks. I went to all of the marathons and I was one of the helpers.
Yeah.
But what I saw over and over again is at the beginning, when people would introduce themselves, they'd look real boring to me.
Yeah.
And often pedantic. Like a lot of times, Stanford psychology professors would come and they'd try to impress people that they were famous and they were experts. And then I think, boy, that guy's an asshole. He's in for trouble. Because when people came across like that, they really got ruthlessly attacked. It was almost unbearable. And then when you would see that person suddenly crash, and the moment they gave up their pretentiousness and showed their inner, and then they would begin sobbing and talk about their son's suicide the previous year and the grief that they had been feeling or whatever was going on inside. they suddenly became incredibly compelling, and you felt incredibly close to them. It was almost like magic. But I had to see it to comprehend it.
You want to go beyond the ego, the protective shell.
Yeah. Now, one other thing we could cover in this one, if you want, is something comes up in workshops when I'm teaching therapists about the 5 secrets of effective communication. The disarming technique, the thought and feeling empathy that we've discussed in previous
we had a
podcasts.
couple podcasts on that. Yeah,
the inquiry, I feel statements, and affirmation or stroking, those techniques, and how to handle various critical patients, and we role play it, and I demonstrate it, and those are very dramatic and fun experiences and workshops. But inevitably, somebody says, "Well, how do you deal with a patient you don't like?" And my answer to that is similar to my answer to how do you deal with a boring patient, is when you don't like a patient, the solution, the 100% instant cure for that works all the time in a way that leaves nothing to be desired, is you have to tell the patient immediately that you don't like them.
Yeah.
But again, you have to do it in a kindly and an affectionate and flattering way.
And that's kind of difficult.
Yeah, all of these things are difficult. They sound easy when you read about them.
Yeah.
But to do them is an art form. It's like anyone can go up to a piano and pound on the keys.
Yeah.
And using the 5 secrets of effective communication without a lot of training, it's like pounding on the keys of a piano. It's not going to work very well. But I'll give you an example of this, and I'll show you the subtlety of the technique. One of the patients that I dislike the most in my whole career, and I might say that the patients that I've disliked the most have always been the ones that I ended up liking the most. Once I did this, it was another paradox, feeling the closest to. But the hardest one for me was this fellow was referred by his parents, and he was a beefy redneck type of guy. He lived at home, and he was a construction worker, and he drank beer constantly, and his parents referred him to me, thinking he was kind of lonely and depressed, and so he would come obediently to sessions, but he never did any psychotherapy homework. He didn't seem to have any agendas for the sessions, and he smelled horrible. He smelled like he peed in his pants or something like that.
Yeah.
And I had cloth furniture, and so after he would leave the session, the office would smell like a urinal, and other patients would raise this question. Maybe they were thinking I peed in my pants or something. It would take a full week for the smell to clear up, and then he'd come in for another session and stink the place up again. And so that was disconcerting. And then all he did in sessions was talk about how much fun it would be for him and me to get together at night and we get drunk and rape women. And I was just disgusted by this fellow, and by his appearance, by what he talked about, the whole thing. And I found myself thinking, I wish he'd drop out of therapy, and I wish I wasn't stuck with this guy. I can't stand the guy.
Yeah.
And then I told myself, but David, remember your rule. You have to tell him instantly that you don't like him, or bad things are going to happen. That's the only effect that'll work. And so I procrastinated for a couple of weeks. Because how are you going to tell someone you smell like piss and I can't stand you? It doesn't sound like the most therapeutic, compassionate.
No, it sounds very rejecting.
And then I said, I've just got to do this. And so he came in for like his 4th or 5th session. I said, Ralph, I'll just call him Ralph. I said, there's something I have to talk to you about, and it's going to be tough for me to do it. And I'm worried I might scare you away or frighten you away from therapy, and I don't want to do that. But I was thinking something if we talked about, we might be able to develop a better relationship. Would that be okay with you if I take a crack at it? And he said, well, absolutely. And I said, well, Ralph, this is really, really hard for me to say, but I don't know how often you bathe or if you're aware of this, but you have a really strong body odor. It smells like urine, really, like you peed in your pants or something. And then the smell stays on the furniture after you go, and quite a few patients have complained about it. And then the other thing is you haven't done any psychotherapy homework, and you talk about, all you do is talk about you and me going out and getting drunk and raping women. And I don't know if you've ever considered how disgusting that is to me and how disturbing that is. And then I got to thinking about the fact that I was just wishing you'd drop out of therapy because I disliked you so much and, kind of couldn't stand you. And then I thought, wow, this is the best thing that could happen. Because here your parents referred you because you're kind of lonely and not connecting with people. And I'm someone that's being paid to connect with you. And on one level, I really like and admire you. And on the other hand, I feel like I'm being pushed away and like I want to get rid of you.
Well, did you actually like and admire him on any level?
Well, there was a level on which I did kind of like him. You've got to always speak from the heart. You have to find something. You work with what you got. Yeah. And I said, and so then I got excited because this is probably the very, very problem that you're having, with people in general. And so then I thought, well, gosh, maybe that'd be okay to talk with Ralph about. And it was that in mind that I want to mention that to you, Ralph, and see how you feel about it and what your experience has been. And he took it very well, and he didn't seem upset or threatened. He came back the next week all cleaned up, and he'd been working hard on his psychotherapy homework, and he turned out to be a very, very rewarding guy to work with. I ended up just liking him a whole lot. But that was just one example.
And just simply by sharing how you were feeling. Now,
but it's not just that. Because you can share your feelings in a really brutal way to hurt someone. So there's got to be some affirmation, some stroking. Right. And I always say to the psychiatric residents that I train at Stanford or the psychology students, you can say anything you want to a patient at any time you want, no matter how brutal it is. And you can do it within 5 minutes of meeting the patient for the first time. Timing has nothing to do with anything in psychotherapy. But the one rule is, whatever you say to the patient, you've got to make him or her feel like $1 million. And then if you do it like that...
It's called diplomacy.
Yes, that's right. That's right. So that's my spiel on how to deal with a boring patient or a patient you don't like. But I use those same principles with my loved ones and with friends and colleagues and people.
Let me twist that a little bit and imagine that you have a patient that you don't like because he just can't connect with the team CBT model. It's like, he doesn't want to do the effing homework and things that this is not going to work for him or for her. And how do you, and let's say, there's like this conflict between you and the patient because consistently it's like, well, that doesn't work. This is not good enough. Maybe I need a different approach. So
there's many ways to respond to that question because that's really the question of therapeutic resistance and how we approach it. So I can give you a very specific answer to just one little part of that, which is the patients who don't want to do their psychotherapy homework. Yeah. And do we have time to approach this? How are we doing?
We have a couple minutes.
Just a couple of minutes. Well, I'll give a quick response to it, and then we might want to have a whole other podcast on difficult we could patients, difficult clients, challenging clients, critical clients, clients who seem unmotivated.
I didn't want to take you on a different tangent, but I thought it was kind of relevant to what you described.
Well, it's really the most important question in all of psychotherapy is patients who don't want to do their psychotherapy homework. They want to just come and talk and complain. It sounds insulting to say that, but some people just seem to want to complain endlessly and get support. And some therapists seem willing to offer that. I've never found it effective. Early in my work as a cognitive therapist, I began assigning homework. The early psychoanalysts never assigned psychotherapy homework, and in the 1930s and 40s, the first papers appeared by psychoanalysts who started to use psychotherapy homework as a way of having patients practice certain things between sessions. And then when the behavioral therapies got popular and the cognitive therapies in the 1960s and 70s, homework became very, very important. But all therapists realize that a large percentage of your depressed patients simply don't want to do psychotherapy homework. And they're also the ones who tend not to improve. And so I tried all these techniques to persuade my patients to do psychotherapy homework. And I've developed techniques. Albert Ellis developed techniques. Aaron Beck developed techniques.
Yeah.
For example, one of Ellis's techniques that I tried is when you have a patient who doesn't do homework, you tell them to give you $100 and a note written to the Grand Wizard of the Ku Klux Klan.
Yeah.
And it's this is a contribution and appreciation of your
very behavioral,
work.
Reward and punishment.
Exactly.
Yeah.
And I'll put this in a letter and put a stamp on it, and we'll address it, and I'll keep it in my drawer here. And then if you don't come back with your homework next week, we'll mail this your contribution. Well, I would say that of all the 50 techniques I tried, not one of them, including that one, ever worked once. Mm-hmm. Patients who weren't doing their homework weren't going to do their homework, and helping them with it, demanding it, rewarding it, all of that didn't work. I finally found a technique that did work, and it's the only one that ever worked. And in around, I think, 1984, I wrote a memo called the Concept of Self-Help Memo. And I mailed it, and I still use it. It's still very effective. And I used to mail it to the patient before the first session.
Yes.
They had to read it and fill it out and bring it to me all filled out and completed. And if they didn't do that, they weren't even allowed to meet me. They couldn't come to their first session until they had completed that assignment. And the memo pointed out that there are a lot of ways to get over depression or anxiety or whatever else is troubling you. And coming and talking is good. Some people might need a medication, like if you're hearing voices or something like that. And then some therapists emphasize self-help to pinpoint the problems in your life and use techniques to solve those problems. And this is very much what's done at this clinic. We'll listen to you, we'll use empathy and support you, we'll give you medication if you need, but we emphasize the self-help work.
Yeah.
And you'll be expected to do psychotherapy homework if you're accepted as a patient in this clinic. And then the memo described the 10 most common forms of homework, like taking tests between sessions to measure your depression, keeping a journal of your negative thoughts and identifying the distortions in them if you're depressed. Things like that, just simple things that make pretty good sense. And then the memo asks the patient to respond to several kind of contract questions. And the first is, I understand that my therapist will require self-help homework, consistently throughout the treatment if I'm accepted in this clinic. And they have to put yes, no, needs discussion. The next question is, I agree to do psychotherapy homework consistently if I'm accepted in the clinic. Yes, no, or needs discussion. They tick one off. Next question, the number of minutes per day I agree to spend on psychotherapy homework is blank, and they have to write in, 10 minutes or 30 minutes or whatever they're willing to do. The next item is, I'm willing to do this X days per week, and then I'm willing to keep this up for X number of weeks. So I have to fill all that in. Then the memo concludes with a list of 25 good, and good is in bold, italics, capitals, good reasons not, and the word not is in bold, italics, capitals, not to do the psychotherapy homework. And then the memo lists the 25 best excuses patients gave me over the years why they shouldn't have to do psychotherapy homework. Like one would be, I heard that depression is due to a chemical imbalance in the brain, so I shouldn't have to do psychotherapy homework, I just need a pill.
Yeah.
Or I want someone to listen and support me. I don't want to do a lot of homework assignments, or
right.
I'm too overwhelmed, or I'm too perfectionistic, and I might make a mistake. And
I have a lot of perfectionists in my office. Yeah.
Oh yeah, absolutely. And some of us get that way sometimes too. And then they tick off which ones, describe.
Will be an obstacle for them. Yeah.
Yeah, and then at the end it says, having read all of this, and I would prefer a type of therapy that does not require homework. And the other option is, having read all of this, I would prefer a kind of psychotherapy that includes homework between sessions. And then I review that with them at the initial evaluation, and if they indicate on that memo, as many of them do, that they skip items, they don't put how many minutes per day, or they put needs discussion, or
right.
they indicate that they're not, so gung-ho on the homework, then I just use a technique for dealing with what we call process resistance, and the technique is called dangling the carrot, gentle ultimatum, and sitting with open hands. And what I said, and what I trained my staff to say, was something like, Maria, I really want to work with you, and the kind of depression that you have, and the loneliness you have, and getting abused by your ex-husband, those are the things that I specialize in. I have a special program for treating abused, neglected, rejected women, how to wrap their ex-husband around their fingers, and how to help you get joy and help you get back into the dating scene and overcome your social anxiety. And what a joy it would be to teach you those things. It would be fantastic. And I have no doubt that if we work together, we can make that happen. But I noticed that you indicated that you don't want to do the psychotherapy homework, and you said you've had 12 therapists before, and none of them asked you to do homework. And you also mentioned that none of them were able to help you. And don't get me wrong, I'm not trying to reject you. I'm not trying to get rid of you. I want you to stay and work with me. But you have to know that if you make the decision to stay, the homework item issue, it's not negotiable. And so if you have any doubt at all, any second thoughts about it, I would say, God bless you. I totally respect you. But then I can't accept you ethically as my patient, because the techniques I use will never be effective for patients who don't do homework. But there are a lot of clinicians in the community who would love to work with you, who, like yourself, don't believe in the importance or value of psychotherapy homework. And if you'd like to go to one of them, you won't have trouble finding one. But I'm hoping you'll stick with me. But you'll have to make that commitment, and you'll have to make that commitment especially the times that you're not in the mood, that you don't have the energy. You would have to do it even on those occasions. What are your feelings about that, Bob or Maria or whatever? And that's the only thing that worked, and it was very effective. Initially, I was afraid to do it because, I didn't want to make my patients accountable. I thought they'd get mad at me or drop out of therapy. But we gave that memo to 700 consecutive patients seeking treatment at my clinic in the 1980s and early 1990s, and only seven of them elected not to stay at the clinic. All of the others, it seemed to redouble their eagerness for us to work with them, and so that's how you handle within Team CBT the concept of homework compliance.
I think that we're I don't really want to go over our time, but I feel compelled to ask a follow-up question, which is obviously I'm using your model, and I do give my incoming patients the concept of self-help memo. And invariably, they will agree to do the homework, even though they do check some of the obstacles they may encounter. But in some cases, even though they have agreed and take time to do it, a few weeks down the road, you find that something will not happen.
Yeah. Well, of course, that will come up. I can give you some tips on how I handle that.
Yeah. So what would you do in this case then?
Okay. Well, that's a really good question, and has to do with therapists' willingness to make patients accountable. What I say to the patient, there's two things. First of all, if they even do a little bit of homework, I give them full credit. Like a lot of times, I'd have a patient, come in and hand me a scrap of paper with some negative thoughts, and they probably filled it out on a napkin in the waiting room,
right.
And then I look at it and I reinforce them for doing that. I say, this is fantastic that you wrote down these 3 negative thoughts, and this will give us a fabulous session today.
Yeah.
And if I can persuade you to do that type of thing, on a more consistent basis, recovery will probably be only a stone's throw away. So I want to encourage you to keep it up, because this is brilliant what you did. But if the patient has been doing homework and then stops, then I say, I notice that you've stopped doing the psychotherapy homework, and I'm trying to understand what that might mean. And let's go back at some of the reasons you had ticked off. For example, you may be feeling hopeless, or you may be feeling annoyed with me, or you may be feeling kind of depressed and overwhelmed and unmotivated, and maybe you're waiting for the motivation. And those are some of the things that you ticked off earlier. And that to be in therapy with me requires doing the psychotherapy homework. And I'm just concerned maybe I sold you on something initially, at the initial evaluation, that you're not committed to, or maybe you're now taking a change of heart and thinking you're wanting a different form of therapy. I would hate to lose you as my patient. My goal is to keep you in therapy, but tell me, what your feelings are about that. Maybe in your heart of hearts you don't want a kind of therapy like what I'm offering. You notice what this statement involves is making the patient accountable and giving them in a warm and loving way the message that it will be required. You are going to have to get back on the horse and do the psychotherapy homework. But when I'm in workshops and teaching therapists, I say, how many of you give psychotherapy homework assignments in therapy? And almost every hand goes up. Now, I would say 90% of patients, therapists.
Well, if they're coming to a CBT workshop, that makes sense,
Yeah, but I think with many schools of therapy, probably not all. If someone's psychodynamic, they may or may not, probably don't. But then I say, how many of you have patients who you give psychotherapy homework assignments to, but the patients don't follow through? And then almost every hand goes up again. And I say, see, you're like a parent, a codependent parent who lets the kids get away with stuff. You're not making your patients accountable, because you're saying to your patients, I want you to do psychotherapy homework, but P.S., I kind of know you won't, and I'll love you and accept you anyway. In other words, you're allowing patients to do that, and that's the reason. It's your fear of losing the patient if you make the patient accountable. And I had those fears for a long time as well. But I found, as I learned to firm up and set limits of this type with patients, if I do it in a loving and kindly way, it was rare that I lost a patient who had agreed initially to the concept of self-help memo. But if they change their mind, then that's sitting with open hands. And I would say, if you want to find just a talk-only therapist, God bless you, I'll support that. And if you change your mind, my door is always open to you. You can come back at any time. And so I kind of forced the patient to reject me rather than me rejecting the patient, because I didn't want to get into a malpractice suit or an ethics claim of patient abandonment. And I found that worked very well. But that might be a question to ask yourself as well, because it's hard, because both compassion and self-interest make us want to give in, because you probably like that patient. I know you have a big heart, so you really care about the person. You feel close to them. So on the one hand, you don't want to put too much pressure on them. And then on the other hand, if you're just developing your practice and you're short on patients, then your income is based on keeping that patient true.
Yeah, there's all kinds of factors that come into play here, yes.
Yeah. Okay.
Well, this went a little bit longer than I thought, but I think this was a good entry into what do we do with somebody that is causing some interpersonal problems with us. Yeah,
and we'll do more on this. I really appreciated working with you today, and I appreciate people listening, and I love talking about these topics. Another thing we can do sometime in terms of 5 secrets, how therapists can respond to patients who come on to them sexually or romantically, or accuse the therapist of being sexually attracted to them.
That would be a great one. I think that the interpersonal issues between therapist and patient would be a really great topic or series to do about when we're done with the anxiety model.
Yeah, and it might even be that we could get some therapists here with us and demonstrate the role-play techniques live, so that listeners can see how the training actually works.
We'll see if we can make that happen.
Yeah, we can make that happen. We can get some folks here.
Well, thank you so much, David. That was, as always, very enlightening, and we'll see ourselves again at the next podcast.
Great. Thank you, and thank you, everybody.
This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes for this podcast under the blog page, and where you can leave your comments and questions. The website has an abundance of resources for therapists as well as non-therapists, including books, workshops, a list of online training groups around the world, and much more. Theme music is Gypsy Jazz in Paris, 1935, composed and performed by Brett Van Donsel. I am your host, Fabrice Nye, and I invite you to join us next time for another episode of the Feeling Good podcast.